Hi, my name's Matthew Links and I'm the Discipline Lead for Medicine at Bond University on the Gold Coast, which is Kombumerri country. I'm a medical oncologist and a survivor working in clinical practice for the last 30 years. Today I want to share with you a structure for a meditative and reflective practice for a topic that's a major source of stress for all of us, feeling overwhelmed by the workload. The practice is a combination of mindfulness and some evidence-based problem-solving strategies. The framework is called RAINY, and it's part of a series that gives advice on looking after yourself and dealing with many of the common emotions we all experience in practice. The steps are recognition, noticing how you're feeling and what's brought it on, acceptance or acknowledgement, knowing it's okay to feel this way, investigation, spending some time reflecting on the underlying causes and impacts, and drawing on evidence-based strategies that deal with this particular situation, and then nurturing, turning this understanding into an action that will help you look after yourself. And finally, we want to set an intention to give some thought about how you're going to make this action happen and make a commitment to make it happen. So in clinical practice, feeling overwhelmed by the workload is a major stressor. Now it's important to remember it's not your fault. The health system is under major strain and there's a need to focus on what you can control. This is true from both a system and an individual perspective. So a system perspective leads to actions like advocacy and quality improvement. But very often the main things you can effectively change are those individual things that relate to yourself. So the key concepts that help with understanding where our stress is coming from is one, to focus what's on our control. Secondly, the demand and resources model, which sees workplace stress as an imbalance in between demand and resources. 3, the process of cognitive appraisal, where we can reframe the way we're thinking about the workload. 4, learning some new skills that will help reduce the stress and improve your performance. And 5, addressing that motivation. So the first step of RAINY is recognition. And recognition starts with understanding that you are feeling overwhelmed or stressed, how much of a problem this is, and what's impact it's having. This is a good time to stop and think, do you need to seek help? The triage into how serious the feeling of overwhelm is. And I would encourage you to seek help. The next thing is to think, where is this feeling coming from? Is it coming from clinical work? Is it from non-clinical demands? Is it from a particular location or site or ward or team member? Recognise what area it is that you need to focus on to be able to improve the situation. The next step of acceptance or acknowledgement is to accept it's okay to feel overwhelmed and resolve to be kind to yourself. So one of the wicked things about health is that there's so many demands on us and many of them are immovable. So reducing demand is not easy. However, not all of the demands are immovable. In some situations, issues like people-pleasing, procrastination, disorganisation, failure to delegate or over-treatment may be contributing. So you want to think carefully as to whether any of these issues apply to you. Think carefully as to whether learning to say no, learning to work more efficiently would help. Think carefully about low-value care. So, for example, if you order daily bloods, you have to check the results daily. Is it necessary? Is this providing value care, or are you just covering for the fact there isn't a plan for investigation? Are your patients getting needlessly bled? If you can fix this, there's an opportunity to reduce the demand on your time. Or alternatively, perhaps you can reorganise the system of how you take notes on a ward round or write letters in a clinic and improve your efficiency. These are the sorts of strategies that can help reduce the demand on your time. Sometimes we can't change things about demand or supply, but we can change the way we think about the workload. Perfectionism is endemic in medicine, so it's worth thinking, is this a problem for me? Cynicism is a sign and a contributor to burnout. Is this a problem? Are your expectations of the systems, colleagues, and of yourself reasonable? Sometimes what we need to do to feel less stress is to adjust those expectations. Now, increasing resources is difficult. Often we think that what we really need is an extra person, but getting extra staff is difficult and it takes time. In many services, there can be some flexibility, though, to move resources around between teams, but often there isn't, and perhaps this requires us to work smarter. So bringing personal resources to the point of care is a strategy. Carrying your tendon hammer might save you looking for one while you're on the neurology team. It's about making sure you've got the resources you need to do the job to hand. The information resources you have stored on your phone are one critical resource that you do have control over. Do you have access to all the information you need? Utilising technology can be a way to work smarter. There are usually multiple ways to enter something on the EMR, but what's the most efficient way to do it? Can you identify a better work practice that saves you time? Remember also that attention is a resource. Minimising interruptions during critical tasks is a way of improving your efficiency. Perhaps you can redesign your workflow to bring extra resources, such as a prepared handout for the cardiac catheter discharges, or getting the patient to fill out a symptom checklist in the waiting room. One example we did was improve the writing up of chemotherapy, was to bring all the resources together into a chemo write-up session, ask the pharmacist to attend and get it all done in one go. Just think about the way you practice and if there is a way of bringing extra resources together to make the job easier for you. Now, a critical question is to ask what tasks are causing you stress and whether learning more skills would help. If breaking bad news is stressing you out, you can get some training in this task. If you aren't great at cannulation and this is a stress, then get training in that task. Think broadly about the types of skills that might help you. Maybe reading about advocacy skills, or buying a time management app, or doing some reading around teamwork or how you manage your emotions. Whatever's driving the stress, there should be some skills that will help you. Feeling confident and competent is really helpful. Okay, so now you understand a bit about why you're stressed, and you've identified some strategies that might help. Now it's time to think about how you're going to look after yourself. Perhaps this is about learning some new skills. But don't forget also about the importance of connection. Connecting to a mentor or a coach or a supervisor for advice, or to other team members. You can also think about repair strategies for nurturing yourself. What works for you to recharge your batteries? Have some of your recovery strategies fallen by the wayside? Perhaps you need to try a different strategy. Make an investigate and nurture statement that brings together your understanding of what the stress is from and what you're going to do about it. So this might go something like, I understand what the result of your investigation, and I commit to making these steps from your nurturing plan to look after myself. So having a plan to look after yourself is good, but now you have to put it into practice. A good strategy is to have a self-care plan and incorporate your intended actions into that. Or perhaps you need to incorporate learning the new skills into your learning plan. Or perhaps you want to change the way you do things. And one helpful way to think about this is about creating a new habit. So I really recommend reading a little about the science of habit change. One of our academics, Gina Cleo, has written an excellent book on this topic. So now you can pull together each of the statements you've made along the way into a rainy statement. And so it would go something like this. I recognise that I am feeling overloaded by my inpatient load. It's okay to feel like this after being on call all week. I understand some of the investigations I've been doing are unnecessary. I'm going to look after myself by getting some clear guidance as to what tests are necessary, reducing the workload of ordering and following them up. I'm going to put a reminder on my phone to help make this happen. I'm going to work smarter, not harder. So in summary, workload is a major stress in clinical practice, and RAINY is a framework that combines mindfulness and guided reflection. There are aspects of demand, resources and appraisal that are all within our control. Low value care, efficiency, system design, use of technology and understanding our own mindset about work are some of the key issues. A self-care and learning plan can help you acquire the skills, change attitudes and habits. So I hope you found this helpful. If you'd like to be guided through a guided reflection, putting this into practice, keep listening after this slide. If you want to know more about RAIN, check out Tara Bruck's website. And if you want to know more about dealing with specific challenges, check out the other talks in this series. And of course, if you think you might need further help, reach out and discuss. So good luck dealing with the workload. Remember, the system is under enormous strain and we're all coping the best we can in an imperfect world. Good luck. So thank you for listening to this part of the presentation where I'll take you through the RAINY guided reflection. Once you get the hang of it, you can do this as a self-directed process. But let me lead you through this as an example. So let's start by setting ourselves up in a quiet, comfortable position, whatever works for you. Turn off your phone and set aside 10 minutes. So let's start by closing our eyes and concentrating on the breath. Just breathe in and out normally. Clear your mind of whatever thoughts you've been preoccupying you. Just breathe in and out. In and out. And if your mind wanders, just return to your breath. In and out. Now let's just start by recognizing how you're feeling. How you're feeling stressed by your workload. Perhaps you feel a little stressed or overwhelmed. Just recognize where you're at. Just breathe in and out. Next, let's make a point of being kind to ourselves. It's okay to feel stress. Notice any tendency to feel ashamed or blame yourself and just focus on being kind to yourself. Remember, the whole health system's under stress. It's okay to feel overwhelmed. Now let's take a moment to think about what we can do, what's under our control. The first step is to think, where's the stress coming from? Is it a part of your practice? Is it a person? Is it a task? Just focus on your breath and think about what image comes to mind as you think about being stressed. Can you identify the task or place or person that is causing this? Next, once you've done that, then think about what aspect of this is under my control. Is there an opportunity to reduce the demand? Am I doing any busy work that doesn't really need to be done? Am I saying yes to things I should say no to? So breathe in and out. Perhaps you can bring more resources to the task. Are you delegating as well as you can? Perhaps you need to tell your supervisor that the workload's increased, or ask if there's any additional help or suggestions they can make. Can you learn a new skill or practice being more effective about a skill you already have? Can you reframe the way you're thinking about work and the workload? Are your expectations realistic? Do you need to be just kinder on yourself? Do you need to be kinder on others? Perhaps the only thing you can do is to advocate for system change, because it's out of your control. But advocacy to the right person could help. So just breathe in and out and think about one thing you can do to deal with the workload. So just stay focused on what you can do. If you get caught up in other thoughts, blame or anger or whatever, just let them pass. Come back to your breath and what you can do. So if you need more time, just pause this presentation and resume when you've finished reflecting on the things that are under your control. And if you can't think of any way, then perhaps you can think of a way that you can restore your energy with a strategy from your self-care plan. Perhaps some exercise, perhaps some time in nature, connecting with friends and family, whatever works for you. Perhaps you need to find a new strategy. Take up some exercise or mindfulness. Now, if you've identified something to work on, we can move on to the nurturing stage and think about making an intention to do the thing that will help reduce the workload or to help you cope. Take a minute to think what will help make it happen. Do you need to set a reminder on your phone? Post-it note. Add it to your to-do list. Put some time in your diary. So set an intention on what you're going to do to help look after yourself. So now, before we close, you can bring together what you've reflected on today in a rainy statement. I recognise that I'm feeling overwhelmed. I accept it's okay to feel this way. I understand something about the causes and something about what you're going to do. And I make an intention to carry out that action. And do what I can for the things that are under my control. And if you're starting to feel stressed at some time tomorrow or later in the day, reciting that short, rainy statement might be something that helps you focus on what you're doing to reduce the stress. So thank you. Remember, if you need help, reach out. There's lots of support available. Take care and see you next time.